Period is set to close today. We should point out, though, that Virginia and D.C. has extended their deadline until February 1st, but time is running out. So joining us today to discuss how to navigate this healthcare change is health policy expert Dr. Catherine Hempstead of the Robert Wood Johnson Foundation. Thank you so much for joining us today.
Sure, thanks for having me.
So already the data is showing about 1.4 million fewer people have signed up for Affordable Care Act plans, many saying they can no longer afford their premiums. What guidance do you have for those forced into this difficult position?
Well, it's a really terrible situation because many people in the marketplace are going to encounter very significant premium increases compared to what they paid last year, or if they're new to the marketplace, what they expected. And not surprisingly, we're seeing a big decrease. I think the best thing to advise people is to look carefully at the plans offered in their area, and if they need to make the decision to buy a bronze plan instead of a silver plan because the premium is more affordable. I think, certainly that's better than going without coverage, even though there will be more out-of-pocket spending.
What are some other ways that you can find more affordable coverage plans?
Well, I mean, I think you want to look at the range of offerings in your area. There, in many states and in many rating areas, there is really a big range between the most expensive and the least expensive plan in a metal level. And then if you feel that the silver plan is, the premium is a little bit too high this year because your tax credit is smaller. And unfortunately for some people, they've lost their tax credit altogether. For people over 400% of poverty, that's when the decision to drop to a lower metal level is at least going to give you that really big picture financial protection in case something terrible happens to you. You have that coverage that comes with insurance. But the trade-off and the disadvantage is that you're no longer going to feel that your day-to-day access to care is as affordable, because in many cases you have a much bigger deductible, and you have a larger out-of-pocket max. I mean, I wish I had a better solution. It's an accommodation to a very difficult situation. I mean, the best thing, of course, would be to extend the enhanced tax credits and to keep the affordability for people.
And what are some of the future impacts of so many Americans not having coverage? How does that potentially
Yeah.
impact the overall healthcare system in our country?
There's huge effects, and we're also anticipating a lot of coverage loss from people losing their Medicaid coverage as well. And while the consequences are terrible for the people that are personally affected, their health consequences, their financial consequences, people will get exposed to more debt and have trouble paying other bills if their healthcare costs more. But then there is a ripple effect on the whole system, because when people can't go out and get care, that's bad for hospitals and providers. And then people show up and need care, sometimes in emergency situations when they maybe also can't pay for the care. So we're forecasting a big increase in charity care, uncompensated care as well. So these things are going to put tremendous strains on the provider system. So that's doctors' offices and hospitals and, the healthcare system in general.
And this whole matter can be very overwhelming for families. Where do you suggest people go for more information?
Well, I think for everyone, that's thinking about the ACA marketplace, going to their exchange is really, a great start. We're talking about mostly Maryland, Virginia, and DC here, and all three of those regions have their own state-based marketplace. But for other people, healthcare.gov is a great place to go to start to at least see what plans are available in your area. And even if you live in Maryland, Virginia, DC, you forget the name of your state exchange, go to healthcare.gov and you will get pointed to the right place. And there you'll be able to compare the plans and the different metals and see sort of what is your best move in what's absolutely a very, very difficult situation for consumers.
All right, Dr. Catherine Hempstead, thank you so much for joining us today at Noon.